G'day and welcome back to the channel. So in today's video, I want to talk about pregnancy-related back pain, but more specifically, I want to discuss why pregnancy-related back pain may not actually be due to pregnancy at all. Now that may sound strange considering that a lot of women don't develop back pain until they're pregnant. So it makes perfect sense that if you didn't have back pain before your pregnancy and you are now developing back pain while pregnant, that the pregnancy was the thing that caused that problem to be there. But I want to propose a few ideas throughout this video that will hopefully challenge your perception of what's actually causing that pain in a really positive way so that you can actually do something about this and that you don't have to wait until you're no longer pregnant in order to expect your back pain to get better. You can challenge some of these ideas to take away that back pain so that out of all of the things that you have to deal with while pregnant, back pain doesn't have to be one of them for most people. Now, getting into the concept of this video, I want to base everything off of what I'm finding with my pregnant ladies clinically. And I think the really important thing to touch on first is that it's really important to reinforce that being pregnant is normal. There has to be something going on there that pregnancy exposes. And from what I'm finding clinically with my patients, there's a few ways that we can sort of connect these dots for you to figure out what that is. Now, one of the things that I think is really important to do here is if you have a tennis ball or a lacrosse ball, we can use this to play detective to find where your low back pain is centered, where it's coming from, and then we can use that information to decipher why that section of your back has become a problem. So what we can do with the ball is we can take the ball and press the ball into your lower back. Now, ideally, I would get you lying onto your back to do this, but again, depending on how far along you are with your pregnancy, it might be easier for you to do this sitting on a chair, leaning up against a wall, or standing up against a wall, just so that you can change the way that you're positioning your body to make sure that it's the best and the safest position for you and the bub. But what I want you to do is if you can take the ball and press it right down into the base of your spine, and you'll feel the bumps down the middle. And like we always do on the channel, we want the ball just to roll off to the side a little bit. And then we need to get you to gently lie down on top of the ball or lean up against it, up against the wall, depending on what's most comfortable for you. And again, what we want to do here is we want to take note of how it feels, obviously. But we're not just looking for tenderness, we're looking for tightness and stiffness. We're looking for restricted tissue. And what I want you to look for here is take note of how easily the ball sinks in and then compare it to the exact same spot on the other side and compare the two sides. And what you might find very quickly is as you come up and down each segment of your spine, you'll start to get a very clear understanding of where you feel the most restricted and potentially where your symptoms are coming from. So for example, if you go all the way up to the base of your rib cage, just off to the side of the bump, onto the spinal joints, potentially the rib joints as well, if you push here and you feel something travel down to your low back, maybe a band of low back pain, maybe it radiates down into your hip, maybe it's that sacroiliac joint pain that you didn't know that might be connected to higher up in your back, it's very important to understand where those symptoms are coming from. Because if you found a spot in your back, let's just say it's here, which is sort of the general area of where your back is sore, there has to be a very specific set of reasons why that section of your back is a problem and not lower down and not higher up. And after discussing this with pregnant women for 15 years, generally there's one thing that consistently connects the dots to why that is. And from what I find clinically, it generally comes back to the shapes and the postures you put your back into. If you know that this section of your back is the most symptomatic, if you then relax into the position that you get into the most, and if you find that this is also the section of your back that you hinge through the most when you sit, then it's very likely that the positions and the postures that you've adopted long before being pregnant are now starting to get exposed by being pregnant, or the changes that happen while pregnant. Now, it's not to say that if you never felt pregnant that you would never get back pain, but what you might find is that if exposed to enough time and enough pressure and enough suboptimal loading, that tissue may become sore eventually, even without being pregnant. So the picture that I want to really paint here to really help people better grasp the cause of that pregnancy-related back pain is that if you can take a step back and understand where your main symptoms are coming from, not where the symptoms are, but where they're originating from, and then layer over the top of that your postural and your positional habits, we can very clearly start to see a strong overlap between those two things. So it's important to understand that you potentially took some level of dysfunction into pregnancy, And pregnancy may never bring it out, but if it does, it just tips you over the edge and starts to develop that back pain while you're pregnant. Obviously, there's a lot of physiological changes, like your posture changes, your weight shift changes, your center of gravity changes. But this is really important to understand, because if back pain during pregnancy is genuinely making your life much harder than it probably already is while being pregnant, then there's some things that you can do to change that, so you can take that out of the equation and just focus on the real pregnancy related issues that you may not be able to click your fingers and get rid of, in a similar vein to this back pain related stuff. So the detective technique that we did with the ball doubles as a treatment technique as well. So if you know exactly where your back is a problem, you can take the ball, place that ball into the wall or on the floor, lean back into it and gently let the ball press in. So we're not rolling around, we're not sort of jumping around on the ball. We're finding a spot that feels genuinely important for you. We're putting enough pressure on the ball so that you feel like it's sinking in and releasing some of that tightness, getting some of that stiffness to move and free up, and then moving on to the next spot. So you can hunt around with that ball to free up as much of that tenderness and soreness as possible, and then reassess how you feel day to day. So anything that you can do when you can do it while pregnant to improve the quality of your low back and hopefully start to reposition yourself a little bit better, then obviously the faster this back pain will go away and the less likely it will be to follow you post-pregnancy into those also challenging stages of a newborn's life. So, but just to ram that point home, if you do have pregnancy-related back pain, there's every chance that it's not due to being pregnant. Yes, it's come on while you're pregnant, but the pregnancy, at least from what I find clinically, is more likely to expose some hidden, boring, underlying, pre-existing low back dysfunction that was already there pre-pregnancy, and sort of bring that out and challenge that further while pregnant. I fully understand that being a male talking about these things, it may be harder for me to have the same kind of empathy that a female physiotherapist may have, but I'm basing this off of the things that I see, having treated, tens of hundreds of pregnant ladies who've come to me with really nasty back pain, that we've been able to help them get better, obviously without having to tell them to wait until they're no longer pregnant for this to get better. So being pregnant is challenging enough without layering over the top of that a whole bunch of potentially avoidable and reducible low back pain. So again, hope that was helpful. Best of luck with the rest of your pregnancy or your post-pregnancy, whichever stage you're at the moment. Hope it goes well, and I'll see you in the next one. Bye.